Magnetic resonance imaging (MRI) working principle. An MRI scan uses a large magnet, radio waves, and a computer to produce an accurate cross-sectional image of internal organs and structures. The scanner itself typically resembles a large tube with a table in the middle, allowing the patient to sleep in. An MRI scan, since it does not use potentially harmful ionizing radiation, differs from CT scans and X-rays. The invention of the MRI scan is a significant breakthrough for the medical. A non-invasive instrument. Physicians, scientists, and researchers are now able to explore the inside of the human body in great detail. Examples in which an MRI scanner can be used include the following: brain and spinal cord anomalies in different parts of the body, cancers, cysts, breast and other abnormalities, certain kind of cardiac issues, liver disorder and other abdominal organs, assessment of female pelvic pain with causes such as fibroids and endometriosis in women undergoing examination for infertility, suspected uterine abnormalities. By no way is this list exhaustive. The use of MRI technology is growing in reach and use all the time. Risk and safety using MRI. Patients must usually remain very still during the entire MRI process to obtain good quality images. For the operation, babies, young children and other patients who are still unable to lie may need to be sedated or anesthetized. Sedation and anesthesia bear complications such as sluggish or painful breathing and low blood pressure, which are not unique to the MRI procedure. For patients with implants, external instruments, and accessory medical devices, the MR area poses specific safety risks. The MRI scanner's solid static magnetic field can pull on magnetic materials and may cause the medical device to move unwantedly. Radio frequency energy and magnetic fields that change over time cause the implanted medical device and the surrounding tissue to heat up, which may result in burns. The existence of the medical device will affect the accuracy of the MR image, which may render the MRI scan uninformative or may lead to incorrect clinical diagnosis, leading potentially to improper medical care. The magnetic fields and radio frequency energy created by an MRI scanner may also cause the failure of electrically active medical devices, which may result in the device failing to deliver the intended therapy. The implanted medical device has been positively identified as MR safe or MR conditional. Patients with implanted medical devices should not be given an MRI test. In all MR conditions, an MR safe system is non-magnetic, contains no metal, does not conduct electricity, and poses no non-hazards. An MR conditional system can only be used safely in an MR environment that matches its safe usage condition. MR unsafe should be considered to be any system with
Working principle of MRI. MRI make use of the magnetic properties of certain atomic nuclei. A hydrogen nucleus, which is single proton present in a water molecules and therefore in all body tissues. The hydrogen nuclei partially allied by a strong magnetic field in the scanner. The nuclei can be rotated using radio wave and subsequently oscillate in the magnetic field while returning to equilibrium. Simultaneously, they emit a radio signal. This is detected using antennas, which is coils. Very detailed image can be made of soft tissues. In this figure, in the absence of a strong magnetic field, hydrogen nuclei are randomly aligned as in A. When the strong magnetic field is applied, the hydrogen nuclei presses about the direction of the field as in B. Main component of MRI. First, scanner, next computer, and then recording hardware. Scanner. An MRI scanner is a large tube that contains powerful magnet. Main component of scanner is static magnetic field coils, gradient coils, and radio frequency coils. The diagram shows that how MRI scanner look alike. There are three methods to generate magnetic field. First, fixed magnet. Second, resistive magnet. Third, superconducting magnet. Fixed magnet and resistive magnet are large and complex. They need the coils to be soaked in liquid helium to reduce their temperature to a value close to absolute zero. Gradient coil. Gradient coils are used to produce deliberate variation in the main magnetic field. There are usually 3 sets of gradient coils, one for each direction. The variation in the magnetic field permit localization of image slices as well as phase encoding and frequency encoding. The set of gradient coils for the z-axis are Helmholtz pairs, and for the x and y-axis pair saddle coils. Radio frequency coil. Radio frequency or RF coil act as transmitter and receiver. RF coil are the antenna of the MRI system that transmit the RF signal and receive the return signal. They are simply a loop of wire, either circular or rectangular. Helmholtz pair coils consist of 2 circular coils parallel to each other. They are used as the Z gradient.
How an image generated in MRI. Human bodies made up around 65% of water. The water molecules contain hydrogen and oxygen, where hydrogen protons are the part that used to measure the signals from the body when MRI scanner is running. Since there is a lot of water in human bodies, there are a lot of signals to measure the magnetic field and radio wave, which produce an image more details. Hydrogen protons use MRI to produce an image. When an MRI scanner applies, a strong magnetic field appeared. Hydrogen protons move and align with the field. The RF pulse shows up and disrupts the proton and forces them into either 90 degrees or 180 degrees realignment with the static magnetic fields. Since the RF pulse pushes the protons against its nature, the proton realign with magnetic fields and release the electromagnetic energy. The protons absorb the energy from the RF wave, then flip on their axis and emit energy back to the coil. That signal turns into an electric current which the scanners digitize. The scanner processes the signal using advanced algorithms computer in order to produce the image. Tissue with less water in it will have fewer hydrogen protons to emit signals back to the RF coils. Those areas appear darker on the MRI scans. The varying signal strengths get translated into various shades of gray, which radiologists recognize as different types of tissue on the scan. MRIs can be used to scan the brain, joints, and other parts of the body in order to highlight abnormalities such as cancer, stroke, broken ligaments, and aneurysms.
Okay, firstly, we're gonna see advantage when we're using the MRI. Okay, firstly, MRI is particularly useful for the scanning and detection of abnormalities in soft tissue structure in the body, like the cartilage tissue, and soft organ like the brain or the heart. Okay, secondly, the advantage, there is no involvement of any kind of radiation in the MRI, so it is safe for the people who can be vulnerable to the effect of radiation, such as pregnant women or babies. Okay, lastly, MRI scan can provide information about the blood circulation throughout the body and blood vessels, and also enabling the detection of problem related to the blood circulation. Okay, for the disadvantage MRI, we can see MRI scan is done in an enclosed space. So the people who are claustrophobic, fearful of being in a closely enclosed space, are facing problem with MRI to be done. MRI also can involve really loud noise while the processing, because they involve a really high amount of electricity supply. And lastly, MRI scanner are usually expensive. Okay, for the last slide, we're gonna make some conclusion. Okay, MRI imaging safety risks are unique and require a true knowledge of MRI hardware, electromagnetic principle, and contrast agent to recognize potential source of injury. Minimizing this risk, however, also require application of this knowledge in a practical and effective manners. And although regulation and standard help form the backbone of MRI safety policies, the development of a culture of safety ultimately relies on the ability of radiologists, technologists, and administrators to tailor their policy to suit their individual facility and the needs of their patients.